So very excited to be here. My name is Anne Eichmann. I'm a professor at Yale and Innovator Awardee 2022. And I'm here to pitch D2B3, which is a new startup that enables drug delivery, D2, across the blood-brain barrier, B3. So together with my team, composed of scientists and a businesswoman here at Yale, we developed and patented monoclonal antibodies that transiently open the blood-brain barrier. So you know that most drugs do not cross the blood-brain barrier, and therefore most brain diseases cannot be cured, and this is a major unmet medical need. Only 2% of all small molecules cross the blood-brain barrier and can be developed as drugs, as you heard earlier today already. The vast majority of all other molecules do not cross and are not developed as drugs. And so D2B3 addresses and overcomes this obstacle. And you can see that after an intravenous injection of our antibody, the blood-brain barrier becomes open to a red fluorescent drug, which can now reach the brain, as you see on the left panel, whereas on the right panel, without the antibody, the drug remains inside the blood vessels and does not reach the brain. In practice, we inject this antibody intravenously at low doses, followed by injection of drugs. Here, a small molecular drug called cadaverine, and we can more than double over a period of 30 minutes the amount of drug delivered into the brain, as quantified on the left side, and you can see a visual on the right side. Again, the drug reaches the brain in the presence of the antibody, but not without. There are no effects on permeability of vessels and other parts of the body, and the effect is reversible. It lasts less than 8 hours. If we inject the drug 8 hours after our antibody, we no longer see the leak. And this is because the antibody is unstable and rapidly degraded, and this enables this transient on-demand blood-brain barrier opening. We can deliver nanobodies that can be, we can deliver bioactive molecules less than 70 kilodalton in size, and these include nanobodies that can be engineered against any brain target, growth factors such as BDNF that increase in the brain, but their plasma concentration remains the same. And this delivered BDNF is biologically active because it can phosphorylate cognate TrkB receptors in the brain. We can also enhance tumor cell killing by delivering chemotherapeutics that normally do not cross the blood-brain barrier, such as vincristine, as shown here, or doxorubicin. So we believe that our technology has a significant market potential for brain cancer, brain metastases, neurological diseases, and infections. And let me remind you that the global CNS drug delivery market size is estimated at $130 billion in 2022, and will grow even further over the years to come. We are competitive as our antibody technology is the only technology that is based on the transient interruption of a known mechanism required for maintenance of the blood-brain barrier that enables reversible, non-damaging, and brain-wide delivery of drugs, and actually it enables the delivery of various drugs, and it can be injected intravenously. And this is the publication on the right that shows this from our lab. D2B3 is based on rigorous science. We developed the antibody against a target which is called UNC5B. This is an endothelial transmembrane receptor and guardian of the blood-brain barrier integrity. And we showed that this antibody blocks the binding of a ligand to the receptor, and this enables blood-brain barrier opening by changing the expression of permeability proteins on the endothelium. So I discovered function of this pathway, and I'm a world authority in neurovascular research. The antibody we generated is a fully monoclonal antibody. We isolated it from a synthetic human antibody library by screening against the UNC5B extracellular domain. We have 10 hits, and we're testing 9 backup hits together with CROs that produce and test our recombinant antibodies. And our lead that I presented to you has very high affinity to both human and rat UNC5B. Therefore, it can be directly applied to humans and tested in preclinical rodent models in the lab. We don't expect any significant toxicity, as similar antibodies made against the ligand have shown good safety profiles in human studies. So going forward, we use the Blavatnik funding to have CROs reproduce our transient blood-brain barrier opening in their hands. Dose escalation studies are underway and tox studies as well. Backup antibodies are being tested, and in vivo proof of concept studies will be completed by the end of this year, focusing currently on chemotherapeutics delivery and their preclinical efficacy in brain cancer. We will branch out afterwards into brain metastasis and other indications. We are seeking partners for lead optimization and IND enabling studies, for which we estimate $5 to $8 million will be needed. Thank you very much for your attention, and here's our contact information should you be interested in contacting us.